everyone, I am Praveena. Today we have an interesting topic about the latest technology in knee replacement with robotic system. Chennai's first 4th generation Whaley's Johnson & Johnson robotic system has launched at Prashanth Super Speciality Hospital. Dr.Arumugam has performed more than 5,000 knee and hip surgeries across the world with almost 100% success rate. Joining on to the show, it's my pleasure to introduce Dr. S. Arumugam, a highly skilled proficient orthopedic surgeon who is based in Chennai. He's refining his skills for the past 25 years. Welcome, doctor. Robot is going to operate and you're going to sit in the room and watch the operation, or it is how? Because many people have that myth that the robot is performing the surgery.
Yeah. Well, as far as knee replacement is concerned, I don't have a console where I sit and the robot operates. No. Here it is a robot assisted knee replacement. The robot is going to assist me. It is not going to go and do the surgery. What I will do is, it will give me a picture of, I will mark so as to where the knee is, where the medial articular surface is, where the lateral articular surface is. I will give the bony points to the computer. I will be feeding it into the computer, and after creating a 3-dimensional image, it will suggest so as to how to place the implant. But I will decide on what is best for my patient. I will adjust the placement according to what that patient requires, and I will hold the saw and I will be cutting the bone. The robot is not going to do everything on its own. It is going to do everything on my command, and only thing is, it is going to help me do the surgery precisely to the millimeter, to the degree of rotation, flexion, extension. Everything is going to be perfect. It is just going to help me do these cuts and take these cuts to perfection. After doing each cut, I will use an array to check if what I have planned is what I am implementing in that case. In case there is a mild altercation somewhere, I will be easily able to go back to one step, readjust the cut, and then redo the cut again and correct whatever difficulty or difference that has come in during the procedure. So it is just going to assist me. I will not be sitting in the next room and watching the robot do. I will be operating, I will be using the robotic arm, and I will be cutting the bone. So I am the surgeon here, the robot here is just assisting me. So it is robot assisted knee replacement, and it is not a complete robotic knee replacement.
So it was a much needed explanation, because many of them had the myth, when they hear it is a robotic surgery, they think like the robot is going to perform the entire procedure.
Because in other cases, if you're talking about gastroenterology, or if you're talking about urology, there are places where the surgeon sits in the console and he uses the jockey, and he guides the different components and he operates. So he sits inside a console and operates. But that doesn't happen with knee, because the variations, the bone and everything, I keep flexing, extending the knee without me holding all that. It is not possible, at least not now. But I don't know what is there in the future. In the future, maybe I will be sitting in a console and I will be operating. But as of now, I am doing the surgery and I need control when I am operating.
Pretty well explained. So do you do a bilateral knee replacement surgery at a single shot using the robotic assistance?
Well, yes. I am a surgeon who has been doing bilateral knees for a very, very long time. So I won't let the robot hold me back. In fact, it is helping me do. And I have started doing bilateral knees as well. Initially, I started doing only single knees, but now I have started doing bilateral knees at a single go. I finish off on the left. I usually start with the left knee. I finish off with the left knee, and before I actually cement the prosthesis, the robot is dismantled, taken from one side and put on the other side and gotten ready. So by the time I cement the prosthesis and get ready with the other knee, the robot is ready on the other side. So I'm able to do both knees at one go, and it is helping me do everything to perfection, and in pretty good time too.
That was quite informative, sir.